parents understand the importance of childhood immunizations, and are their children up to date when it comes to immunization?
The immunization is important for a child because they don't get sick. It prevents them from diseases, and so that they don't get polio and get other diseases. Yes, my child is up to date. The clinic was open throughout the COVID. We used to come to the clinic and then they immunize the children.
She's up to date, and then they preventing for immunization, polio, and the diarrhea.
My child is up to date. She's going for immunization, every treatment, and she's getting every injection or immunization. It is good for the baby because it makes her or him to grow up and to be strong enough, and it avoids giving the baby diseases.
Why should children get immunized? What is the recommended vaccine schedule, and how long does immunity last after getting a vaccine? Hello and welcome. I'm your host, Dr. Musam Tombeni, and signing with us is Tsepo Maseko, and the feeder interpreter is Pumza Sekumba. On Vital Signs, we focus on childhood vaccination. African Vaccination Week is an annual event celebrated during the last week of April in synchronization with the other WHO regions and the World Immunization Week. The goal of the African Vaccination and World Immunization Week is to strengthen immunization programs by increasing the awareness and the importance of every person's need and right to be protected from vaccine-preventable diseases. Coming up on the program, producer Zama Buthelezi spoke to a nurse at Mofolo Clinic in Soweto about the impact of routine childhood vaccinations during the pandemic. We'll then speak to general practitioner about the importance of childhood vaccines, and we'll speak to the manager of the vaccine program from the National Department of Health about the significance of commemorating World Immunization Week, as well as the importance of immunization. Remember that you could be part of the show by asking the guests that we'll have in studio or even on Zoom the questions that you have in your mind by simply sharing the views that you want to have discussed. The number to call is 011-714-5861 or 011-714-5877. You can also share your thoughts with us on social media by using Twitter at SABC Vital Signs or our Facebook page, SABC Vital Signs. We continue our discussion on childhood immunizations after this ad break. Welcome back to Vital Signs. Namhlanje sikhuluma ngokugoma on the show, and of course we'll have our guests to look at this. This is Vital Signs, and of course it is on SABC2. Now, the COVID-19 pandemic has disrupted planned vaccination drives in 15 African countries, with over 16 million African children missing their measles vaccine doses since January 2020. Now, immunization is one of the best ways to protect your child against the risk of serious diseases. Zama Buthelezi visited Mofolo Clinic in Soweto and spoke to nurse Yvonne Muloyi, who is the operational manager of Mother and Child, to find out whether the easing of lockdown restrictions has seen parents now visiting the primary healthcare facility as often as they used to before the COVID-19. Let's have a listen.
As we commemorate African Vaccine Week, we put a spotlight on many community health facilities that saw a huge drop in the numbers of parents and guardians bringing their children for immunization because of the COVID pandemic. Sister Yvonne Muloyi, who is the operational manager, Mother and Child, talks to us about whether Mofolo Community Health Clinic was one of these.
Only dropped around May, because then there was still a lot of confusion. But if you look at our data in the following month of June in 2020, our numbers were picking up.
What are the parents and guardians say were the reasons they stopped visiting Mofolo Community Health Centre for immunization in the past 2 years?
Some of the parents would then tell us that they feared that they would get COVID in the clinics, because those patients that had COVID were in our facilities, so they feared that they would get that the disease in the facility. And also, then you had to be screened, and before you come into the clinic, you'll find that the queues are very long. Then, so that you are properly screened, and then you don't pose a risk to the other patients inside the facility. So some of them will don't want to wait in that queue for a very long time.
How can this facility assist children who missed out on their routine immunization?
There is an opportunity. We have a catch-up campaign that we can give missed doses to those children. But I just want us to be wary of saying they can just sit and come back at a later stage, because there's a cutoff. There are vaccines that you cannot give after a certain period, that you cannot just get that vaccine because it's now contraindicated. So if there is a mother that has missed a dose, we'd rather come to the facility and then we look at what is it that we can still offer to that child.
Sister Muloi advises parents and guardians who are asking why they must vaccinate their children if they are healthy.
Immunization is not for sick babies. Immunization we give to also healthy babies. We need to immunize our children because it then prevents them from getting ill with diseases that would have been prevented by the immunization. Even healthy babies will get polio. Healthy babies will have measles. So we want to prevent them from getting those diseases because it's unnecessary when there's vaccines that are available to prevent from them getting those diseases.
We asked Sister Muloi if the easing of lockdown restrictions and COVID-19 numbers decreasing has seen those who missed doses coming back.
We are seeing them. They come back drips and drabs, but we remember even during that period of COVID, we had campaigns. We reached out. We had the government systems like the ward-based outreach team to trace them if we are missing these babies in the facilities. So we went out to get them back into the clinic before even lockdown restrictions were eased. So yeah, now that they are eased and there's a little bit of people that are relaxing, that now probably the COVID is not there like they are saying now, they are coming into the clinics.
Sister Muloi talks to us about the significance of African Vaccination Week.
It gives us an opportunity to have an awareness so that, like we are doing today, so that we send positive messages to the community. There are people out there still that don't even know what is the importance, seeing that they don't even honor the appointment days to come to the clinic. It's because I don't think that any mother would want their child not to be immunized. It's because they don't understand what is the importance. So during the African Immunization Week, I think then we would be able to go out there to them to celebrate and to make sure that we take the opportunity now to reach those that they are not coming into the clinics and make sure that they get the vaccine that they're supposed to get.
After the break, we'll speak to Dr. Marlon McKay, a GP, about the importance of childhood vaccines. Stay with us. Welcome back to Vital Signs. Now, African Vaccination Week is celebrated each year in the last week of April and aims to promote the use of vaccines to protect all Africans against disease. Now, vaccines are one of the greatest scientific innovations of our time. In the past century, they've brought us closer to ending polio and help eradicate smallpox. And in the last 30 years, vaccines have helped half children's or child deaths globally. Today, the vaccines protect us against a number of diseases, over 20 of them, from pneumonia to cervical cancer, Ebola, and saving countless lives every single year. Of course, we continue our discussion. We'll have a discussion with our resident GP, Dr. Marlon McKay. Thank you so much for joining us today, Dr. McKay.
Thank you, Doctor. Thanks for having me again.
Lovely. So let's start breaking things down from the perspective of what immunization means. I think this idea of vaccines has had a long, big discussion over the past couple of years with, the advent of COVID. But what does immunization mean in this perspective?
So To immunize someone or to vaccinate someone is a process whereby you give a small particle of a certain substance related to a particular illness, which is then usually injected into a person. In this case, we're talking about a child, and that stimulates the child's immune system to develop antibodies against certain illnesses. So that when the child is exposed to an illness, for instance, be it measles or TB or chickenpox, the child then has protection against that illness, which they would not have had they not been vaccinated. So immunization is a critical part of a child's development, where we are able to give a child a certain level of protection and even the ability to prevent certain illnesses, and especially particular illnesses that would, if they didn't have the vaccine, would have been serious or life-threatening or even fatal illnesses. And as you mentioned in your intro, by the process of vaccination, we've even been able to eradicate a few illnesses. So in short, immunization is critical to a child's development, whereby we are able to give a child protection and even to prevent certain illnesses that otherwise would have caused serious harm to a child.
So why give these immunizations or vaccines to healthy children? What is the benefit of this?
Well, that's exactly what we want to do, because even healthy children, because one has never been exposed to a particular illness, you can have the best immune system or the strongest immune system if you're able to measure it, but you are still susceptible to that particular infection because you have never had it or you've never faced it before. So this is all about keeping our children healthy. It's a fallacy to think, well, my child is healthy, I put them on immune boosters, they eat a good healthy diet, therefore they do not need vaccines. That is false, because these illnesses can hurt and harm even the healthiest of kids. So the reason we target especially healthy children, in fact all our children, is because without a vaccine, one has no protection against certain illnesses. And these illnesses can cause harm no matter how healthy you perceive your child to be.
A big discussion that happened, especially around the idea of COVID vaccination, was this theory of vaccine making, where vaccines are made too quickly. But what is the case with children's immunizations? Are these new vaccines that we've just gotten our hands on now, or are these things that have been studied over time?
So fortunately with children, these are vaccines that have been around for many years, some even up to 60 years. So there is a certain level of trust in the vaccines. And I think, as you mentioned, there was always a bit of mistrust and suspicion around the rapid development of the COVID vaccines. And if I can just point out very quickly, remember, because vaccines have been around, the platforms were there for the vaccines. Money was available for COVID-19 vaccines, and all the testing was done. But while the testing and the different phases were happening, manufacturing started, so that by the time the vaccines were given emergency use approval, there were already stocks available. So in that sense, we don't have to fear the COVID-19 vaccines just because they were developed very quickly. I think it was a bonus that they were developed very quickly, but the platforms were there. And so the trust is there. And I think the difference with childhood vaccines is that parents want to wait to see, do these vaccines work? Are they safe? Are they effective? Do they cause any harm? And because these childhood vaccines have been around a long time, we have much more faith in them. Newer vaccines are available, but what's usually happening today is that they're putting 2 or 3 different vaccinations in one, so that you can have fewer injections or fewer visits to the clinic. So you may get a 4-in-1 vaccine, a 3-in-1 vaccine, which just makes things a little easier to administer the vaccines across many healthcare facilities.
The big issue a lot of the time is this issue of safety around vaccines, where a lot of parents, a lot of caregivers or people that, would have to take the children to get the vaccine worry about safety. So what big issues lie within the safety of childhood immunization?
Okay. I think the first thing we worry about is the short term. Is the vaccine, the side effects of the vaccine? And what we see with kids is that you can get a painful arm, a bit of a temperature, maybe sometimes even a rash, and the child may develop a flu-like illness, but those are short and of short duration. So they tend to settle after a day or two, and the kids are fine again. But with the vaccines having been around a long time, we can see that the vaccines are safe and effective. And years of observational studies, years and years of meta-analyses have proven, reviews have shown that the vaccines are safe. There was a period where there was some negativity around certain vaccines. For instance, there was a scientist who tried to link the measles vaccine with, for instance, autism. That had been published, but subsequently that data has been shown to have been falsified, and those articles have now been retracted. So far we see that none of the vaccines have been associated or directly linked to any other serious illnesses, which leads us to this conclusion that overall vaccines are generally seen to be safe and effective, and therefore can be trusted. And so we urge parents to make the time to get your child vaccinated on time and as per the schedule.
So let's speak about that schedule. I think a lot of people have this general idea that a child needs to go to a clinic at some point in time occasionally and get a jab here and there. But what does the schedule actually look like in South Africa, and what do they get when?
Okay, so it's a very broad question, but basically the schedule starts literally from birth. For instance, the BCG vaccine, which is against tuberculosis, is given at birth. DTP can be given at birth. And then you have the schedule, and there's a beautiful chart that the department puts out every year, whether the vaccine is given in 6 weeks, at 10 weeks, at 14 weeks. Some vaccines start at 6 months, your measles, mumps, and rubella, and then there's boosters that are given. And right up till about age of 12, we have this complete vaccination schedule. So it's very critical that from birth, your child gets available, all the available vaccines. They are free, they're available at the clinic. Not to skip the relevant dates. When you leave the clinic, the sisters give you the exact date that you must come, be it at 6 weeks, 10 weeks, 14 months, be it at 3 months, be it at 14 weeks, be it at 3 months, 6 months, at 6 years, at age 6, 12 years, and also important that some of the vaccines need boosters every 5 to 10 years or so. It's critical to stick to that particular schedule for that vaccine. Vaccines work on ages, so it's very, very important that we stick to the different age groups and schedules for that particular age.
So what happens if you miss a vaccine? I think the experience that we've all had of lockdowns and COVID and inability to access public health facilities, and I guess doctors just in general to go get these vaccines. What happens if you're a 10-monther that's missed a 6-month MMR? What then happens at that point? Can you still go get it, or do we just exclude it altogether?
I think it's very important that you try and get it. Unfortunately, one of the consequences of the pandemic is that everything shifted, all our attention shifted to COVID and many of the childhood illnesses and schedules, and that goes across the board, be it in HIV, type 2 diabetes. All the management tend to take a backseat to that because of COVID. So within that, we're encouraging everyone to please come back and get it. And so as in your particular example, some of the vaccines, if it's too long, may be contraindicated, but I think we can make allowance for certain important, the critical vaccines that need to be given at a particular time. So if the schedule is not too long, we can still squeeze it in and then just adjust the different time frames. But I don't think anyone should feel, well, I've skipped one, it probably is too late now, therefore I'm not going to go back. Please go back. The sisters are there to advise and then to make sure that we can catch up. And most of the vaccines we are able to catch up. It's very important that we make sure that we are up to date with the vaccines.
Lovely. We continue this discussion, of course, and look at all things that have got to do with vaccination and immunization in the children. That's what we're talking about today. If you have any questions, the number to call is 011-714-5877 or 011-714-5861. That is the number you can call if you have any questions for the good doctor. Going for a quick ad break. We'll see you after this. Welcome back to Vital Signs. This is Dr. Mofolo Community and namhlanje sikhuluma ngokugoma ingane. Now, childhood vaccines or immunizations can be seen quite overwhelming when, you're a new parent. There's so much misinformation and myths about these vaccines, and sometimes parents take this as a reason to not get into it and go out and vaccinate their children. They use this as skeptical ways to get away and around vaccines, but will continue to put their children in danger of contracting preventable diseases. We'll continue our discussion with Dr. Marlon McKay, a GP, and find out what else is important to know about vaccines. Dr. McKay, let's get back into it. I want to speak about parents that stay away or keep children away from getting their vaccines because of all kinds of thoughts that they may have or the research that they've been doing. What does that mean in South Africa? Is this something a parent can do legally?
Yeah, so this is such a controversial point. Generally, and I think with the COVID-19 vaccines, this whole movement, what you call the anti-vax community, is increasing more and more. And yes, you're rightly so. Parents are starting to keep kids away from being vaccinated. I'm not too sure about the legal precedent just yet, but it's absolutely vital that our kids get vaccinated. You can just imagine, I wouldn't want my child to be in a school or in a class with a kid that's unvaccinated, because that child can then get what we call a vaccine preventable illness, such as measles or chickenpox, and then spread it to my child. I've taken the time to have my child vaccinated, and now there's a weak link, as it were, and an entry point for that illness, and that's illness which is potentially serious, which can harm the other children in the class who have been vaccinated. So there is a certain level of from an ethical point of view, out of respect, and also for the benefit of the community. So there's an individual benefit for all of us to be vaccinated, and our children, but also for the community. And this is where this term herd immunity comes about, because the more kids in a community that are vaccinated, the better the protection, and everyone gets the benefit of that protection.
So I want to get into what you've just said. A lot of people that are against vaccinating or don't want to or hesitant bring up that argument where if someone or if most of the people in the class have gotten their vaccines and my one child that doesn't have the vaccine goes out and contracts something, their big argument is always but you already got the vaccine, so you've got nothing to worry about if my one child brings in the vaccine, brings in the disease. So why is this important to break down?
Yeah, because for the simple reason that, number one, we have no guarantee that my child will not get it. We have no guarantee, absolute guarantee, that my child will not get very sick from that illness, as we can see with COVID. Yes, the general perception is there, and that's why we vaccinate. But I think it's a selfish viewpoint to say, well, why are you worried about this? But also, we can see a resurgence of illnesses that have almost been virtually eradicated, Doc. You see, things like polio. I mean, when last have we seen polio? But it just takes one child who has not been vaccinated for that particular illness, which is vaccine preventable, to be reintroduced into society. So, yes, we can think on a micro level that, well, you're vaccinated, so you've got nothing to worry about. Don't bother yourself with my child. But you can reintroduce certain infections, and it just takes one child to get it, and that then can spread it. And with you having that attitude, more and more parents join in, and then you get more and more kids. And soon we lose out on that herd immunity, we lose out on that protection, and we see these flare-ups, the little micro-epidemics that can flare up in certain communities of measles, be it chickenpox, whatever the case is. So it's absolutely important that we be fair and make sure everybody is vaccinated for the benefit of everybody. It only takes one child to reintroduce an infection, and that's not right.
We've got Nosipo on the line. Nosipo from Cape Town, good day.
Good day, doctor. How are you?
I'm well. How are you?
I'm good also.
Good. What's your question?
I'm calling regarding my son. He went to Congo in December 16, so he's currently staying there. What I'm concerned about is that he did get all his vaccination from the born age up until 11 years. So now he's turning 12 on this January. What I'm concerned about is the vaccine of the 12 years of age from the childhood one.
Okay, so the idea of a potentially missed vaccine at the age of 12, how do we address that? But I think we can open up just a bit more. What happens in children whose vaccine history we don't necessarily know at whatever age? What happens there? Can we go out and just give them, all the shots that we potentially can, or do we weigh it out with respect to, what they could potentially get?
Yeah, so that's always a difficult point. In this case, with a 12-year-old, they would need the DTP booster. And I'm sure you have to check with the local clinics in that particular country, or when the child visits, you can catch up, because it's more of a booster. And I'm glad to say the mum has said the child is up to date with all the other vaccines. But if you have an unknown situation where you have a child that's probably almost a teenager, say 10, 11, or 12, and the vaccine history is unknown, then it's a lot more complicated. You can't just give all the childhood vaccines all over again. You probably have to start with the relevant vaccines for that particular age, because it could well be too late. Now, fortunately, some of the vaccines from about 5 or 6 years are already starting to be reintroduced. So you can kind of catch up maybe with a 6 or 9 year age gap and give that vaccine. But this is why it's so critical to have that clinic card and that vaccine history, so that you know exactly what your child has got. But my view is that it's probably not feasible to start a child with the childhood vaccines, for instance, that would have been given at birth, and suddenly give it to them at age 12.
Let's look at this issue of acquired immunity versus natural immunity. Another argument that is brought up quite often with respect to immunizations and having children get the immunizations. How and why is it important to get the acquired immunization versus the natural?
Yeah. So by natural immunity, we're talking about what if my child does get chicken pox? Surely they are then immune from chicken pox again. So that's a fair statement, and it's true. However, we know that natural immunity wears off. And the natural immunity is never as effective as vaccine-induced immunity. And there was a time where we used to have these H1N1 parties, swine flu parties, where parents would get the kids together, just get them so that they can become immune to it. And I think that can be very dangerous. One should not depend on natural immunity for protection. The protection can wane, it can wear off. It is never as strong as vaccine-induced immunity. And also, Doc, imagine, if you're relying on natural immunity, you have no guarantee that how sick your child will get with that particular illness, especially with some of them that are serious and life-threatening. So I wouldn't want to depend on natural immunity, because my child could get extremely sick and have complications. I would much rather depend on vaccine-induced immunity. I know it's safe, I know it's effective, and we know exactly how long it lasts.
Children with comorbidities, can they also go get the normal schedule of immunizations?
Yeah, so this will be under guidance from the treating doctor. Generally with comorbidities, remember they are more at risk of these vaccine-preventable illnesses, so it's important that they get it. But there are certain cases where one would need guidance, especially with kids with cancer, and especially if they're undergoing chemotherapy, where the immune systems are extremely weak, and sometimes the vaccine may overwhelm that particular immune system. Also, maybe in transplant patients, children, where they're on immunosuppressants. So that would be under the guidance of the treating doctor or the cancer specialist. But by and large, for most of the comorbidities, we would want and insist on the children to be vaccinated.
Now, vaccines are normally, this idea that we have for younger children, from birth to about 5, 6. And then, of course, we start speaking about boosters and things such as that. But there are other vaccines that are available to the tweens. Let's speak about the HPV vaccine. What goes into it, who qualifies for it, and what does it actually prevent?
So that's a very interesting point, because here we have one vaccine that is not just preventing vaccine-preventable illnesses, but is actually preventing cancer. We know that one of the biggest cancers that we have today, and the biggest killers, is cancer of the cervix. And the biggest cause of cancer of the cervix is human papillomavirus, called HPV. And so there are 2 vaccines that are currently available that are given generally to younger children before their sexual debut. So usually between the ages of 9 to 13, 9 to 14, given in 2 doses, usually about 6 months apart, highly effective in the prevention of cancer of the cervix. So again, it's not for small children, but a little bit older, and parents need to be aware, and it's on the vaccine schedule. It's given freely in the clinic. So parents need to be aware of that very, very important vaccine.
So the important thing you mentioned there is that it's before sexual debut. But I think speaking just in general with respect to immunizations, with the HPV vaccine, when else can you get the vaccine if you're not in that 9 to 14 age group?
Yeah, so you can actually get it a little bit older, all right? But obviously the data was done in the younger kids, and that's where we saw the maximum benefit of protection. But that's not to say that someone a little bit older can't get it. What I would suggest, if someone is already sexually active, we would usually run the test to make sure that they don't already have HPV, if it can be detected already, be it by a pap smear or other screening tools. And then if there's no evidence of it, then one can still use the HPV vaccine in that case.
Thank you so much, Dr. Marlon McKay, for joining us today to speak about childhood immunizations. And of course, that's what we're talking about today, ukugoma kweyingane, and why it's so important to do so. After the break, we continue our discussion with someone from the National Department of Health, as we'll be speaking around the program that we have as we wrap up April. Welcome back to Vital Signs. Now, over the years, vaccines have generated some controversy over safety, but no significant convincing evidence of harm has been found. And although children have this reaction to any vaccine as they would, the important thing to know is that the benefits of the vaccine far outweigh the possible side effects. Let's welcome Ms. Elizabeth Maseti, Manager of the Vaccination Program from the National Department of Health, to talk to us about the significance of commemorating World Immunization Week, as well as the importance of immunization. Good day. Thank you so much for joining us.
Good morning, everyone, and the viewers at home. Thank you for this opportunity.
So we are celebrating World Immunization Week. Why is this week so important, and why should we stand up and really commemorate it?
The World Immunization Week, which is also known as the Africa Vaccination Week in our region, has been commemorated since 2010. It is the commemoration just to increase more awareness on the importance of vaccinations and how the vaccination has saved lives for many, many decades. If we look at the first vaccine, which was developed in 1796, which is smallpox, up to the latest vaccine, which is COVID-19, how it has saved most people's lives. And the people now are able to live a longer life, and they're able to live healthy due to the vaccine. So it's just to increase the awareness on the importance of the vaccines on saving lives.
So we come out of a pandemic where a lot of access to immunization was obviously not able. You know, a lot of people couldn't go to facilities and get the vaccine because of lockdowns and things such as that. Where do we currently stand with respect to catching up all the children that miss their vaccinations, and of course amplifying the vaccinations with the new kids, I guess, for lack of a better expression?
Yes, thank you for raising that point. As we know that the COVID-19 pandemic has disrupted most of the essential services, and immunization was also part of those services which were disrupted. If you can look at the state, we have missed many, many children during 2020. But late 2020 in South Africa, we intensified the catch-up campaign where we have tracked all the children who have missed the vaccination. But we are still missing a lot of children. We are really urging for the caregivers or the parents to bring the children for vaccinations. Because if you look at the benefits of the vaccination, I mean, it is more beneficial because children are living longer and children are living healthy. They are able to go to school. They are able to grow into the womanhood or manhood to make things possible to the lives of the South Africans.
Now, a lot of the time we find ourselves looking for facilities. I know with myself, anytime I want to go access anything, I always want to like Google where the nearest place is. So with respect to getting a vaccine for a child or getting immunizations, where and which facilities can people access? Can someone walk into a quaternary hospital and ask for immunization for the child? Or how does one go about getting access to these services?
Most immunizations, vaccinations, they are given at the primary health care facilities, which your clinics, your community health centers. But remember that in South Africa, vaccination are given also in the private sector. If from the private sector, it's either from your GP or you're from mainly our clinics and our DISCAM and all others. And the hospitals, the private hospitals, they've got stock nest and all the others. But in the public sector, they are mainly given in the primary healthcare setting. But even in the hospitals, they are giving a routine immunization as long as the child are there, like you're admitted in the pediatric ward and the child is due for the vaccination today. But in the hospitals, they won't be open for the public just to come and receive the vaccination there. It's for the children who are admitted at the hospital who are getting the vaccinations. But any other person can visit any clinic or any community health center to receive the vaccinations for free of charge. Thank you.
Education is an important aspect that goes into getting vaccines. What is the government doing with respect to the National Department of Health with educating parents about the importance of not just getting the vaccine, but continuing to follow up for the subsequent vaccines that follow?
We are doing a lot on making awareness on the vaccines. We've got a campaign called Side by Side campaign, which is targeting the children of under 5, but making sure that the communities, all the adults and in the communities, they're being made aware of and educating them about the importance of prevention aspect of Side by Side, where immunization is the key there to prevent children from the infectious and communicable diseases for their life to be saved from these vaccine preventable diseases. Because, I mean, there are vaccines to prevent most of the killer diseases. Because if you look in the past, before the measles vaccines, most children were dying from measles infection, but now we do have a vaccine, so we really don't need any death from children from the measles virus. So we do have the vaccine.
The idea of information versus misinformation is one that has come up a lot in recent years, where you as a government obviously want to push through the correct information, but a lot of misinformation also lives within the realms. People saying that immunizations will give your child autism, that immunization doesn't work, that people want to put chips in your body, all sorts of things that we hear at all times. So what big, important take-home messages are out there for people to stay away from misinformation, and how are you countering that misinformation?
One way to encounter the misinformation is that if anyone has been vaccinated or your child has been vaccinated, and immediately after vaccination, you are suspecting that the child has got something or you are having something like which you didn't have before the vaccination, we encourage you to go and report that incident. And whether it's small or big, you need to report it. And if you report it, then we'll take it. We've got a ministerial committee called the NISAC, they are scientists, and they come together and they look at the clinical notes and everything, all the documentation, to see if that event has been caused by the vaccine or not. And then the provinces or the district now, because I'm at National Department of Health, then they will feed back to the client whether the cause, the event what he has reported has been through the vaccine or not. If it is the vaccine, there is a transparency. They will tell the person that is a vaccine. If it is a vaccine, normally we also contact the vaccine manufacturer of that particular vaccine. But this will help to reduce the vaccine hesitancy or the anti-vaccines groups by managing thoroughly with our facilities, especially our health workers, to make sure that they report each and every incident which is being reported to them by the community immediately after being vaccinated, and the person is reporting an incident, it should be reported accordingly with the right documentation. That will minimize those rumors. And also with the education through our social media, we do have the social media from our communication department where we always giving people information on the health issues, also the vaccinations.
The idea that parents are obviously in control of their children's health is an important one, where a lot of parents are finding themselves saying that they don't want to give the child immunizations, or parents staying away from giving the child these vaccines and immunizations. What is the government doing, and what's the legal precedence, I guess, that lives here with respect to parents refusing to give the children immunizations?
Yeah, unfortunately, I will say unfortunately, because the Constitution of South Africa is allowing a person whether he wants to refuse or wants to get a service. So with the children, because they are minor, they don't take their own decisions. It is up to the parent to make sure that the child is getting the vaccines. We do have some parents who are anti-vaccination. Some of them is because of their religious beliefs, so not believing in the vaccinations. But unfortunately, with the virus and the bacteria out there, they don't care about that. If there is a measles virus, it will just affect even that child where the parent is refusing the child to get the vaccination. So with the Children's Act, I think the children are also protected by the Act to make sure that if the parent is refusing totally for the child to get the vaccine, and we see as well that the child is at the risk of dying from this particular disease, then I think the Minister of Health has got a prerogative to make sure that that child will be vaccinated.
Children in school that have not been vaccinated, are you allowed to be in a school if your child, or if the child has not been vaccinated?
Yes, as I mentioned, the Constitution, previously in the previous years, we know that I think maybe even yourself, that before the admission at school, the schools used to require to look at the vaccination card if your child is fully vaccinated. But it has been changed recently. The child cannot be refused to be the admission at the school because of the vaccination status. But I think the schools are the ones who are encouraging the parents for their children to be vaccinated. So with that, we do have the school health teams which are going to schools to children there. If any child a permission from the parent in a form of a consent form to vaccinate that child. Or if it's not possible to get the consent form, then the caregiver or the parent will be encouraged to go to the nearest facility for the child to be vaccinated.
We've got Zandile, who is a caller on the line. Zandile, good day. Hi, Zandile.
Hi.
Yes, your question, please.
Okay, my question is,
Khuluma, sis.
all right. Like I'm fully vaccinated, and then I experience some complications that is in. But mina mangiyoko vaccinated, but kunabantwana abanganabo abazali laphayana, and there was also like in the media said that each and every child une right ukuthi ahamba yo vaccinator without a parent. Then after saying experience some complications like in the abhlungu, I know. Then who is gonna, if a child will go there without the consent of umzali, who is going to be responsible for our complications like our experience by that time? Because I suppose
okay, I understand. Vaccine your COVID, angit?
Yes.
All right, no problem. So the question there really living around who is responsible. I mean, children, you've spoken to the Children's Act, but also to this idea that the Constitution allows parents to refuse. But if a child goes out and gets a vaccine themselves without the parents' consent, and this is, of course, the COVID vaccine in this case, who is responsible if complications do come thereafter? Is it, the nurse that gave the vaccine? Is it the parent? Is it the child at that point in time? Who's responsible?
As I said, that if any person has experienced any adverse event following that vaccination, it should be reported, and by reporting it, it will be investigated if was it truly the vaccine which has caused this this incident, and if it has found that it has been a vaccine.
Ms. Elizabeth?
Some reimbursement for that. So with the COVID vaccination is that, but it is really very important for anybody who feels that I have experienced this untoward the people must come and report back to the facilities and make sure that the facilities are acting on it, and they must get feedback after reporting, whether was it a vaccine or it was coincidental or any other thing.
Very lastly, before we head off, let's quickly speak about the HPV vaccine. We have about 30 seconds. National Department of Health's rollout of the HPV vaccine. Who can and who does get the vaccine?
For the public sector, it is in the schools, in the public schools. Unfortunately, not yet covering the private schools, and is from last year, it is in the grade 5s and from 9 years and upwards for children who are, for the girls only, who are in grade 5.
Okay. All right. Thank you so much for joining us today and really having this discussion with us as we go out and celebrate this vaccination week. Really going out to amplify the number of people that are going out to get their children vaccinated so that we prevent the vaccine-preventable diseases. Thank you so much for joining us, and thank you to our guests for participating with us. This is Vital Signs. I'm Dr. Mofolo Community Health, and we'll see each other very soon.